Meantime, feel free to use the chat box to let us know where you're joining us from, whether that's which community you're in or what room of the house you're in, just so we get a sense of who's joining us and the spread of everyone in the country. And we'll get started in just a couple of minutes. Hey, Florida, Mexico, Kansas, North Carolina, hello. Massachusetts, Indianapolis, Finger Lakes, nice, Missouri. Thank you all for taking the time to join us for our third Community Connection in Times of Crisis webinar. Thank you to those who have already joined our previous two and to those who are joining for the first time. I'm just going to go over a couple of housekeeping notes before we get started. So the first is we do ask that you leave your microphone and your video off while our speakers are presenting, just to make sure that we don't have any technical issues. If you are having technical issues, please reach out to my colleague Caroline, and she can help you troubleshoot. And if we are all having technical issues, if Zoom stops working, we will switch to phone. So the phone number is on the screen. You'll have it in your email, and we will email everyone if Zoom stops working, but so far the technology has been good for us. I also just wanted to note that you can visit our website for a few resources related to this webinar. So some of you asked for Deborah's opening remarks from our first webinar, and we've converted those into a blog post that's now on our website, and you should have gotten it in your emails as well a couple of days ago. We are also posting all of the recordings from previous webinars on the resources section of our website. So the previous two, this one, and all future webinars will be posted there, usually the day after the webinar happens. So I'm going to turn it over to Deborah to kick us off and to introduce our speakers for today.
Thank you, Melody. Greeting you all again from sunny Boston. I was just talking to someone from Brazil and they said, no, that's Brazil. So now we know. Anyway, welcome everyone. It's been really fun to see everybody's new backgrounds and as we all learn Zoom and video conferencing. So thank you so much for participating and for being part of our third webinar in our webinar series, Community Connection in Times of Crisis. We continue to have very positive responses to this webinar series, and many of you are back again, so nice to see that you're participating. We want to reiterate that this forum is for community foundations that want to come together to swap stories and strategies for how you navigate the consequences of the coronavirus. We're particularly interested in how you're exercising your community leadership muscle to help your communities weather the immediate crisis, but also them to recover and rebuild stronger than ever before. These continue to be exceptionally trying times. Many of you have been physically distancing for nearly a month. You're replacing teachers for your school-aged children. You're offering a home base to your displaced college students, and you're serving as caregivers for your elders in some instances, all while trying to stay connected with distant friends and family through Zoom and Skype and FaceTime or whatever your choice of communication is these days. And we know this physical distancing is a really important commitment for keeping each other and our community safe in these extraordinary times. And now the impact of the virus itself and the associated economic downturn are really being felt close to home. Some of you live with essential workers. who may be getting sick. Some of you may have had family members who've contracted the virus. We do know now that a number of our Community Foundation colleagues are falling ill. And furthermore, some of the people close to you may have lost jobs and may be struggling to pay the rent or the mortgage, and you're stepping in to support in whatever way you can. So there is no denying it. We are in really, really hard times. This is tough. And on top of this, as community foundations, you are there to support your communities, and you're helping to meet the extraordinary emergency needs through your creative funds and philanthropic partnerships, and then your thoughtful and quick disbursement of resources right now. And we'll hear from today's terrific speakers about how you're taking the long view when possible. We need to acknowledge that this is not an ordinary disaster with a clearly identified beginning, middle, and end. The size and scope of the pandemic and the economic fallout are massive and exposing our greatest systemic vulnerabilities. With the little energy that we all have remaining, and in the privileged positions from which you sit, we must begin to seize this moment to really strategically build a more equitable society on the other end. So thank you for how much you're giving to your communities in this very hard time. We will get through this, and we'll do better with strong community foundations. So at each of our webinars, as many of you know, we'll hear from colleagues from across the country, from people who have been early on in the crisis, those who are later. We're hearing from large community foundations, small community foundations, rural, urban, etc. Then we'll facilitate questions and conversation with the existing technology, and we've had pretty good luck and have been grateful for those of you who've been willing to use your audio and video so that we can continue to build community in this time of crisis. And then, as in the past, we'll close out with a poem or some sort of story that we hope will bring a little bit of peace and solace to your lives right now. We are very lucky to have two tremendous speakers today, really, really lucky. Stu Comstock-Gay serves as the president and CEO of the Delaware Community Foundation. Prior to joining Delaware in 2016, Stu served as the president and CEO of the Vermont Community Foundation. And I met Stu, seems like 100 million years ago, when Stu was the vice president at the New Hampshire Charitable Foundation. Stu currently serves as the chair of the board of the Mission Investors Exchange and is on the PACE board, Philanthropy for Active Civic Engagement, and on the CF Leads board. After Stu, we will hear from Judith Bell. Judith serves as the Chief Impact Officer at the San Francisco Foundation. She helps the foundation define how they can advance racial equity and economic equity in the Bay Area, which is the organization's North Star right now. Prior to joining the foundation in 2015, Judith served as 11 years as the president of Policy Link, which, as many of you know, is really the leading organization in promoting equity and helping us to implement equitable policies. So I will turn it over to Stu.
Great. Thank you, Deborah. Great to be here. Nice to see that so many of our friends are on here. First of all, I want to acknowledge that everybody on this call could be doing this. We've all got our own stories. We're all doing it slightly different ways. So I merely view this as a chance to share a little bit about how we're thinking about it, and then, of course, hearing from you all. One thing, many of you all have been involved with disaster work before, and as I've been speaking to our Office of Emergency Management, one of the things we've discussed is how this is indeed different. Typically, in a disaster, there is a moment when the disaster occurs, whether it's a flood or a tornado or an earthquake or a fire, and it may roll out for a week or something, but there's a time-limited period in which it happens. Second, because of that, you often know what the problems are relatively soon. They don't keep unfolding. And third, it becomes a place, which means that people can go help and people from outside can help. Of course, the challenge in this one is it's not a specific moment in time, it's a long period of time. The specific problems are rolling out over a long period of time, and everybody's dealing with it, so we can't look outside to get the help. And it makes the work we do here different and challenging in unusual ways as we move forward. Next slide, please. So there you go. Oh, yeah. So the initiative we put together, I'm going to talk about a few, I just have 3 more slides here to tell you what we're doing, and then talk also about our work with government. This is an initiative we kicked off, 3 weeks ago, and it was an intentional effort to try to bring together kind of the leading nonprofit and philanthropic organizations. You can see there, it's us, United Way, our Philanthropy Association, and our Nonprofit Association. The idea being we are working together to align our efforts in this so that there would be a unified front, so that there would not be confusion amongst the public. Also working with government, but this is the nonprofit philanthropic approach to these efforts, and I'll talk in a moment about how we also connect with government. Next slide. So there are 4 primary pieces to this. The Nonprofit Association, which is run by a very strong person, continues to assess nonprofit needs and bring them back to us. She's doing regular surveys and has her networks, importantly, with a lot of the small organizations. While we all do, that's the lane her organization is filling. The Volunteer Community Needs Portal through 211, the United Way is running. That is a thing they had done before. And then we've created 2 funds. And one is what's being called a Rapid Response Fund that United Way put together to really address 60-day challenges toward core service organizations. Looks like that's going to be in the vicinity of $1 million. And that is, as we say, going out relatively quickly. And then what we've created is a long-term, some short, but also long-term fund, which is both to address some of the challenges today, but importantly to be looking at long-term changes to the sector. And if we can put in the last slide here, we can talk about that. So this fund that we've created, we currently have $3 million in it. We've got our eyes on another $1.5 million. And the $3 million came together incredibly quickly, you know, in a couple weeks. And for a small state, it's a pretty unusual thing. Involved with this are the other organizations as well, but heavily corporate. The banks in particular, we're a big banking state, so most of the banks have contributed. Nonprofits are involved. The largest foundations are contributing, and lots of volunteers. That speaks to the reviewers who we have pulled from far and wide, the Grants Council that we're chairing, that the largest foundation, that banks and businesses are on. Right now, we're looking at weekly turnaround on these grants to help some of the core issues. $50,000 grants, we did $350,000 last week. We're doing $350,000 this week. We expect to be doing this for up to 3 months over time. And the last piece of it, which is what I want to spend a little more time thinking about. So there's the urgent grants, and we feel compelled to respond to that. And the monies we're getting from banks and the monies we're getting from the corporations are heavily around that. We also are getting money from our counties that they want us to help distribute some of the money so they don't have to figure out a grants system. Some of it has to be urgent, but what we have emphasized is the longer term challenges to the sector, and we all know this, but we are going to lose nonprofits. Is it 10% of them? Is it 20% of them? Is it 30% of them? And every downturn, you lose some number of nonprofits. We know that's happening, particularly ones that are already weak. But even organizations that have been strong, but there's now not the level of support, and arts organizations are an obvious example that are struggling right now. So a portion of our monies, we're putting together around a strategic restructuring set of grants from $300,000 to $500,000 each, where some group comes together and says, we think we can restructure the way housing services are provided statewide. Remember, we're a small state, we're 1 million people, 2+ hours to go north to south. Many of you have driven through Delaware but never stopped. It's a tiny place, so we can do this. But so looking at large grants to say, when we come out of this, The world will be different, and we have to think differently about how we provide services. It is, to me, probably the most exciting part of this work, and why a number of the funders are coming in. We just today had another foundation commit $500,000 to be matched. And we have a match from another funder, it looks like, who says, but I want to only be doing the strategic restructuring work. Urgent work has to happen. It's heavily done by the government, and we have a role to play in that, but that is not as exciting to me. So that's the big fund we're doing, and I could answer questions about how that's structured and about the relationship between the organizations. As you know, working with multiple organizations with different interests and purposes, you have to work very hard to find the lanes and put people in. You have everybody go in their lane and try not to cross over. Not always easy, but we continue to work on that. The other side of the work that, alongside this package, is the work we're doing with different government agencies. And again, because we're a small state, we know everybody. This is a state where you can talk to the governor anytime you want, the senators, whoever else it is. But so a strong partnership with government agencies, starting with the Emergency Management Office. We talk to them about where they have needs that we or somebody else can provide. And our coalition of 4 organizations is meeting weekly at this point to share information and figure out who can help, and more often when we need to. Secondly, it is not just the Delaware Emergency Management, but through a project we have around social determinants of health. It's a partnership with the university and the State Department of Health. We have people now helping structure the state's response to homelessness issues. Third, we're in discussions with the state about a new initiative, a new funding initiative around arts organizations over time. We hold a $10 million Arts Stabilization Fund. We're going to have to dip into that to save some organizations, but we're having discussions about a longer term new arts funding campaign with them, and then regular communications with the governor's office and the lieutenant governor's office about needs that they see. And one more, Small Business Administration has called out and looking for some help in getting money to restaurants. All of this in this context that we know the federal money is the big money, the state money is the big money, and we need to be supplemental and inspirational money and help bridge to those moments when these things happen. And that's so that's the kind of work we're doing. It's the, again, benefit of a small state. We can get all the leaders on the phone very easily and get a lot of us in the Zoom room to talk about strategies together. And we have built trust over time, so people are comfortable talking to each other, because throughout the year we're at receptions and meetings together anyway. There's just not that big a base of people who are involved with these, and so knowing each other makes a big difference. I'll stop with that. I think I've actually beat my 10-minute time almost, and I'll be happy to answer questions as we go.
Thank you, Stu. Thank you very much for putting together this presentation in a matter of such a short time when you all are so stretched.
I had 15 minutes today.
And we did have a question in the chat, which I will get to afterwards. And as you know, we'll have opportunity to ask questions of both the speakers afterwards. So now I will turn this over to Judith Bell.
Great. Thanks so much, Deborah. And thank you, Stu. It was really helpful to hear your comments first. So as Deborah said, I'm the Chief Impact Officer at the San Francisco Foundation. And our name is San Francisco, but it's actually we are the Bay Area's Community Foundation. We span 5 counties with quite a bit of our work now actually going to 6 and 9 counties as well. I'm going to really focus today on what we've done in the sphere of policy, but I do want to start with giving you a sense of what we've done on the relief side. You know, we're using a framework here around relief, recovery, and resilience. And so in those first steps around relief, we've also launched an emergency response fund that's particularly focused on smaller nonprofits. We had existing agreements with a series of organizations that are critical for disaster relief. Frankly, if you looked at our documentation, you'd see it was quite oriented to the possibility of an earthquake. But here, obviously, we have activated those for the pandemic. So those were all set. We just needed to basically contact folks and the resources started to move. And then we've been a part of a regional effort with our sister community foundations around the region, and that actually spanned 10 counties. And that was a relationship really with county departments and with major organizations in those counties, very focused on direct service. So that has been underway. It's super important, as Deborah talked about. There really is an enormous amount of pain out there, really folks struggling with delivering services, and many folks really struggling to get food on the table, pay rent, et cetera. And it's really the depth and breadth of the crisis, the fact that it is not a crisis that is geographically bound, and frankly not a crisis that is just about health, but now is so much about economics, that has pushed us to be, yes, into relief and doing what we can to raise more resources and moving them as fast as we can. And also to really be thinking about, because of the depth and the breadth, be thinking about the need to be engaged with the public sector and to be engaged around policy and engaged around advocacy. And our work in that way really has had 3 levels of engagement. The first is around tracking, the second is around joining, and the third is around leading. And even when I say leading, it is always in partnership and collaboration with others. We are a very large state and a pretty big region again. And so all that requires just a ton of partnership. All this work really cannot be done by one institution. So we are deep into partnership. We have a history as an institution of being engaged in policy and systems change work. And we do have, we're a larger foundation, and we have a support, particularly around housing, extra support from institutional funders that has allowed us to expand the scope and capacity. And so I say that to acknowledge that you're going to hear we're doing quite a bit, and to say that any one of these examples could be done by really any size of foundation, and that I know each of you in your community leadership has relationships and knowledge and community connections that allow for both operating at the policy realm as well as at the direct service level. So let me give you a sense now of the way we've been engaged. First, let me just say that we, in the policy sphere, we really engage in our priority arenas, and that really is about housing and workers and economic security, and then around our priority populations, which are vulnerable, the most vulnerable, so immigrants, communities of color, and others around the region. So just to give you an example, in terms of tracking, we're tracking across those issues. We're tracking at the local level, the state level, and the federal level to understand what the context is. But in terms of joining, recently a group of funders that have been focused around immigrants came together, and really came together after advocates had begun to move, recognizing that particularly for the undocumented or for families that have mixed status, the federal benefits were not going to reach them. And California has been a state, we have large number of immigrants, and our governor, and really across the state and our regions, we have embraced immigrants as really a core part of our state, of our prosperity, and of our economy. And so advocates had written a letter to urge the governor with his emergency powers to expand the benefits to immigrants. And then a number of us in the philanthropic sector, we joined to a letter that went to the governor yesterday or the day before, and urged him to expand benefits, to pay attention to those who are undocumented. And that is an example of how we have joined with others. Also more locally, we joined in a letter in one of our counties urging for moratoria on evictions. That's now moved to the state level and has engaged both the governor and our judicial council. And then finally, as another example, Alameda County moved pretty swiftly. That's where Oakland is located. to allow contracts, particularly with mental health care and clinic providers, to continue despite the fact that those contracts were set up really based on person-to-person, physically person-to-person contacts, and in some cases, including transportation. And so the county, Alameda County, moved rapidly to say to those service providers not to worry. We're continuing these contracts. We're going to allow you to do what you need to do in this current environment. But Contra Costa, a little bit further east, was not moving to that as quickly. And so we joined with a number of other foundations to urge Contra Costa to follow Alameda County's lead, to allow these critical service providers to continue without the worry of layoffs, without the worry of massive changes to their revenue streams. And in fact, the county then proceeded to do that. We have, as part of this work, been in a quite extensive series of really listening sessions. We've talked to faith leaders, we've talked to folks from the Latinx community, we've talked to organizers, we've talked to partners in the public and private sectors. And an example there where we did take the lead was in our conversation with Latinx leaders. We heard how school districts were not honoring contracts, and a lead agency for after school with 200 employees was really going to have to shut down their shop. It turned out that other school districts were honoring contracts. We contacted the state school superintendent. He had some follow-up conversations, and that allowed for a policy that's keeping those critical service providers that are in limbo now. They will be there when the schools reopen in the fall. Let me just spend a few final minutes talking with you about how we're thinking about leading, and in particular, how we're thinking about leading in that recovery context, because we know that the economic crisis in particular is now going to take us quite some time, and the state's going to need its own recovery steps. And in particular for us, we're focused again on the housing arena, and we are developing an agenda around economic security as well. So we have been working with other funders to think about this issue, not just about eviction moratoria, but what happens when those moratoria are lifted, because people will owe back rent. And we are fearful that our large problem with folks who are unhoused will in fact get worse. And so we're working through a series of recommendations to the governor. We have a number of funders who together, along with organizers and along with academics, are thinking through really how to propose changes, structural changes that really will help our state, our economy to move forward more equitably and to allow us, as we need to bring forth new revenues or make changes, really to allow those changes to be more equitable. And then finally, we're thinking about the distribution of federal resources, which we know will come to the state, thinking about how, for instance, on the housing side, they can help us to continue a commitment we've made long-term, which is to think through the protection of tenants, think through the, and invest in the to continue to meet our future needs. I want to say one final thing before we move on to questions, and that's really around rural communities. When I was at PolicyLink, what I noticed in our work in rural communities was the extent and the breadth of relationships and the ability to move more nimbly than typically happens in places like the Bay Area. And I was struck by the problem-solving approach and really the ability to move from program to policy and back again. And so I would just say that in each of these examples, I think there is a application to small communities, large communities, and mid-size for that matter. And I encourage folks to think through these different opportunities to get to a level of scale of impact that really comes with that focus on policy and systems change. And so with that, I'll pause, and looking forward to a conversation with all of you as you ask questions and we engage further. Thank you.
Thank you, Judith. So if you would like to ask a question, please, if you're able to, you can raise your hand in the box, and then we can call on you, and you can put yourself on audio and video if you're willing to, and you can ask a question out loud. We have a couple questions in the chat box, which I'll start with. One, is this Worcester GWCF asking the question about clarifying shorter term versus longer term? And if you want to unmute yourself and ask that question, I think you were asking it of Stu. It's GWCF, yep.
I just wanted to get a better understanding. It seemed that United Way had the emergency grants, but understanding the difference seemed like you had two buckets.
Yeah, so the truth is that we're funding through our fund some of the same things. And, you know, there are reasons why there are two funds that you can figure. But the design was, they've identified 10 organizations that they say, these are the ones working on the ground that we already support. We want to get monies out to them to distribute to the community. Very direct. Ours are the broader agenda for more types of organizations and more specific organizations in the short term. But while theirs is get the money out, use it this week, ours is more get the money out that you're going to use over the next 6 to 8 weeks. And for the strategic, that is designed as more of a multi-year thing. So there is indeed a little bit of overlap. And, you know, that just is. I don't know what else to say.
What's the size of the larger, more strategic ones?
We're looking at as much as $500,000 for those. And we understand that that is, assuming that works, then we would go take it out to the broader network of funders for longer term support of those initiatives. So that if it's $500,000 that you need over the next year and a half to put some of the pieces in place, or next 2 years, then we would also shop it to corporations and foundations and individual donors to keep that thing going over time.
Great.
But it's taking advantage of this moment where everybody gets, we all know, all of us know that some of the structures in the nonprofit world have not been great. And this allows us to rethink toward better service, more equitable service, more efficient service, all the things that we think we want to see done, and we're taking advantage.
Great. Was that you, Barbara? Barbara Fields?
That was, thank you.
Hey, yeah, she's the relatively new CEO in Worcester here in Massachusetts. Looks like another question here for you, Stu. Carrie Malou, do you want to unmute yourself and ask your question directly to Stu?
Sure. Hi, everybody. I'm Carrie Mayo. I'm with Hutchinson Community Foundation in Hutchinson, Kansas. Yeah, on that same note, I'm curious how assertive you're being with identifying those strategic restructuring opportunities. I think we can see them too, but we tend to be hesitant to ask nonprofits too forcefully to make changes. So just wondering how you're approaching that.
Right question. There is a little bit of a coalition of the willing in this, but in the first round, the first people, it's going to be invitation only. We know some of the things that are already moving in areas. There's some things that are being done around homelessness. There are things, particularly out of the work we've already been doing with the Latino community in Sussex, our southernmost county. Those are things that we're going to say, hey, do you want to bring that in? Because we see you already starting to bridge and create new networks. So we will start with that, but we spent yesterday afternoon working on the RFI so that people read it, and some people are going to say, oh, this isn't for me. So we're going to try to thin it down that way. But the funders are aware of people, and we will go out to them and say, you ought to come in and look at this. This is a great opportunity for you. So it's a little bit of a push me for you, but at the front end, only by invitation, and we hope that models for people the kind of thing we're looking for. What we're not looking for is simply two organizations say we want to merge. That's an important thing, and we will try to get them to somebody who might be able to help them with that, but not this fund is for bigger ideas.
Great. Let's turn to Sherry Brown. If you want to unmute yourself and put yourself on video and ask your question, if you're still there. Sherry Brown.
I'm here. Hi.
Hi.
Hi. I'm not sure if I'm on video. I can't
You
Yeah.
are, we can see you.
Oh, you
We can see you, yeah.
I'm not having my lipstick. Sorry.
It's all good. It's all good.
But I was curious because we collaborate pretty well here in Broward County with Community Foundation of Broward in the Fort Lauderdale area. And what I've noticed, I've looked at some of my peer funders' grantee lists, and I was kind of shocked that, not shocked, but I was taken aback by the fact that many of us are funding the same organizations for, delivery of immediate response programs and services to our residents in light of COVID-19. And when I started just doing a quick calculation, I was like, wow, some organizations are getting a couple of $100,000, while you have others who may not be getting any dollars for service. So I was wondering, how are you, Stu, balancing or managing in your community the dollars that are being granted from multiple organizations to those who are on the front lines, and the optics around some are getting more and some getting less or none? Are you dealing with that at all?
We are. It's a great question, and one we've paid attention to. So one of the things we're doing is sharing, certainly with the United Way Fund, sharing exactly what we're doing and when. So they're doing their second grant round today. We will take that information to our second round tomorrow. So in some cases, we funded the same thing, but for different, like there was one where a senior center got 5 from them and 50 from us. Or similar project, but not entirely, but that wasn't such a huge number that was okay. But if they were to come in and say, we did, as I said, we did 50,000 to the YMCA for their daycare programs for healthcare workers. If they had funded that, we would have talked to the Y about whether they still needed ours or not. So we're trying to be transparent about the information. And then the other thing is, because we're tightly connected to the government entities, and the governor's office has appointed someone to coordinate government responses, and is somebody who's worked with a lot. So we're talking to her and making sure we know what they're up to. So it's constant communications so that we're not getting in the way of each other, and then we're overfunding one. And I'll say, we're also working on a loan program. A bunch of the funders are somewhat related to this. And the discussion we had on that one yesterday was wanting to be careful that the loans we put to a nonprofit, for instance, waiting for the PPP, so they can get through on payroll, that we're not going to run afoul of some other government-based funding program or loan program. So we're being very careful about working hand in hand, not doing that.
I would just add, since we've also have some of this dynamic unfolding in the Bay Area, we're also coordinating with East Bay Community Foundation and Silicon Valley Community Foundation, looking at actually who's come into each of our funds. And frankly, it has been surprising that we don't have more duplication. It may just be that the relationships are somewhat different, and then we are all part of that regional fund, so we're getting that information that is really more where the bigger organizations are benefiting, and that is why we're focused more on the smaller grassroots organizations. There's a little bit of duplication for us in that we are providing our donors with the information about the organizations that we have supported, and we're highlighting 5 per week for our donors on the donor portal when they log in. But because the need is so great, we're not anticipating that that's going to be a dramatic differential, but in fact will allow our donors to help us meet more of the real need that organizations were asking for that we just couldn't meet because these are smaller, faster grants.
Can I ask a quick question on that? How are you deciding the 5 organizations to highlight for your donors? It's really a collaboration between our philanthropic giving staff and our community impact staff, because what we're trying to do is give our donors understanding what they are interested in and where they will tend to migrate. So therefore, variety by geography and variety by focus area, and then really looking at the compelling need. So, it's not an easy decision, but it's a highlight, and then folks can actually click their way through to the entire list of grantees. So if they want to see, more variety, they get there. And our thinking is by giving that variety by issue and by geography,
it's a greater chance someone will find something they're interested in, and that then their interest will be piqued and they'll go to the actual big list.
Got it. Thank you.
Great, thanks, Sherry. Following up on that a little bit, Judith, and I know we have a couple other questions here. You know, you talked a lot about the policy work you're doing, and you've had some good success at engaging donors in your policy work in the past. How are they responding to your thinking now, recognizing we're still very much an emergency? But what conversations are you having with them about the bigger kinds of changes that need to happen in the long term?
You know, we're really at the front end of that conversation. We did a webinar on Monday. We had about 80 participants, primarily our donors and some institutional funders as well. And we started in that webinar to both highlight what was happening on the relief side and begin the conversation about what was going to be needed for recovery. Really now our conversation on the recovery and that longer term is with our institutional donor partners, so
Great,
foundations and corporations. And we're really starting with them to think about what that agenda could look like and how we could come together around it.
Right, great, thanks. Hi, Rose Bradshaw. I guess you have a question about any support for PPP. Do you want to unmute yourself and ask your question and turn on video if you're comfortable? If you're still there, Rose. Rose, if you're talking, we can't hear you. Rose Bradshaw, you still there? I assume it's from North Texas.
Hello?
Hey, Rose, now we can hear you.
Okay,
Welcome.
great. Thank you. This is so helpful to me. I appreciate seeing everybody's faces. I can't point my computer right now to myself. It's looking at my chair in my office, and we're trying to sort that problem out.
I bet you have a nice chair. We'd like to see a chair.
Here in North Texas, we have the kind of the concern emerging among our nonprofits who are having trouble getting in line and capturing the attention of bankers who are leading with their lending relationships. And the bankers, of course, have been underprepared for how to handle the wave that is hitting them of people applying for the PPP. So just curious as to know how you're handling it in both of your communities, if there's a central source of structured support for that.
Well, I'll just say what we've started. It looks like Stu has something to say as well. We have had 4 webinars this week with FMA and offered them some follow-up one-on-ones. And we've done it, you know, with a ton of caveats to folks for the very reasons you just lifted up, which is that banks are ready, many of them oversubscribed, and it's pretty clear that the program's going to be oversubscribed, and that the feds are talking about potentially more resources. So we are providing this service and trying to help nonprofits, you know, with this advising to really decide whether or not it's worth it for them, and cautioning them not to count on the resources, since the program, you know, the number of dollars just don't come near to the need.
Yeah, we are not doing it directly. We've given some money to our nonprofit association, which is both providing some PPP assistance, although as we all know, that money is gone. And though it may come back in a second batch, but at the same time, the funding we put is to help nonprofits with financial planning, and trying to figure out what they need to do, because so many of the small organizations just have no capacity, not just for the PPP, but for much of what they do in terms of the finances. And so we're trying to get some help to them to sort through what their needs are and what their options are, not just how to save, but can they save? So it's tied to that, but being done through a nonprofit association.
Yeah, and let me just build on that a little bit. The reason that we had FMA doing this work is because that is their expertise, that longer term financial management. And we did a spot analysis on the first wave of grants that we got, the grantees coming in the disaster relief. And, you know, not surprising, exactly what Stu said is true. Many of them really don't have, most of them do not have reserves. You know, they are already teetering on the brink. We're already hearing about layoffs. And so we are now talking with our colleagues, including our the Northern California Grants Association, to think about what that longer term capacity building looks like with a heavy focus on the financial side.
Yep.
Thank you both. Stu, quick question. You willing to share the RFI?
Yes, we're still going a few iterations. It should be finished next week, and I will share it then.
Okay, great. And we'll try to get it out to all of you.
Great.
So looks like Barbara again. You want to ask your question of Judith? Barbara Fields in Worcester.
I was just curious about the lending and obviously trying to bridge government money or other funds coming in, and whether you've been working with LISC on that or others.
Yes, we're part of something called the Partnership for the Bay's Future, which has LISC managing a large fund for affordable housing. We have a fund that's supporting jurisdictions on policy all around housing, thinking about those 3 Ps of protection, preservation, and production. And so we were just literally yesterday talking with LISC about how they may need to restructure their products in this current environment. And then we have a deep relationship with Enterprise as well. We're working with them on a host of different things, including we have a new regional housing finance agency, so how they might be key players. And then we're connected to the community development organizations around the region and have already, again, been talking with them about what they're anticipating, both from the preservation and production side. And then I would say, you know, we've got a really big challenge because all those folks who can't pay rent also can't pay it in the homes that the nonprofits own. And so thinking about how we're going to help them to hold on to those homes and to meet the needs of their tenants simultaneously is a very big challenge, and one that we're just in the midst of trying to sort out.
Great, thank you. I have one additional question. So both of you are working with the public sector. Sometimes the public sector is calling you, and others you are sort of trying to, like Judith, how you spoke about how you kind of sought out Contra Costa County about their contracts. What does it take? What does the public sector need right now? And what is it that you are bringing to the table? Of course, dollars are nowhere near close to filling in, and it really isn't our role to fill in where government can't support its basic needs. But what is the role for community foundations with the public sector? How do we be helpful?
I've got a couple thoughts, and you know, we'll have different ones on this, but we sent a letter 2.5 weeks ago from our 4 organizations to the leadership of the legislature, the governor's office, blah, 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 kind of laying out all of the challenges the nonprofit sector was facing and asking for $100 million to the fund so that we could really help these organizations. And it was unbelievable how many people had no idea what the issues were for the nonprofit sector.
Wow, wow.
So at the start, it is to say we have insight into what's really happening in a way that government agencies and government officials often do not. So I would say that's one, that they need our insights about what's really happening out here. 2, I mean, public sector is great at many things, but being thoughtful about new solutions is not necessarily one of them. And so I think we bring that to the table. So those are 2, I would say.
Yeah, I just build on the last point, you know, in a conversation just recently with folks in the governor's office, you know, they are just legitimately so focused on the immediate and the relief, and it's 24/7, and those who were longer term have been deployed into the immediate, that it was clear to us that we really could contribute by coming up with the ideas and starting the conversation with, you know, different sectors in our communities and making the connection to the other parts of the state, so that we can come with some pretty well-baked, not all the way, but well-baked ideas, and then bring those to the governor and bring those to legislative leaders, because right now they are just so focused on relief and legitimate.
Yeah.
And how important are those relationships, those previous relationships with the governor's office, for example?
They're essential. I think that the work of, at a time like this, if you don't have some of those pre-existing relationships, it's just such a bigger lift. Now you can hyperspeed them, but having provided partnership and service and helping folks out and getting things and providing good information all along the way. It's like the job of a lobbyist in many ways. In my old days when I was doing lobbying, you provide information that people need, and then when you need something, you're far more likely to get what you need. And so, yeah, having the relationships is huge. And I think if you don't have them, you can start building them now or start building them for the next time.
Yeah, that's absolutely true. The other thing I'd say is, in a big state like California, being able to aggregate perspective and information is incredibly helpful. And even from the standpoint of what are we hearing from our mayors? What are we hearing from our counties? And then what are we hearing from our nonprofits? Just being able to aggregate that becomes useful. And Stu's right, having those relationships makes all the difference because folks are overwhelmed. And so they're far more likely to respond to folks where they have that existing trust and relationship than to be able to build something new.
Yeah.
So if you don't have the relationships now, then I would say you probably do have relationships with people who have those relationships.
Yeah,
and so use that leveraging, to get yourself into the conversations where you need to be, or to make sure that your information is being carried by others and that you're being drawn in over time.
Great, thank you. So we have a question from Greg Payne. Greg, do you want to unmute yourself and ask your question? And
Sure.
turn on your video if you're willing.
Yes, I'm willing. Hi, everyone.
And tell us where you're from.
Sure thing. So I'm based in the Washington, D.C. area. I work in direct support of small businesses, social enterprises, and nonprofits in this area. Do a lot of strategy and capacity building support. I joined this conversation a little bit late, but I did listen to the recording from last week, and these sessions are fantastic, very insightful and helpful for the work that I do with my partners and clients, particularly now. One topic that's coming up quite a bit, and I'd love to toss this out to the panelists or anybody else who wants to chime in with insights. One topic that's come up quite a bit is this idea of where we're going next in terms of community and local resilience. And I realize that's kind of a broad term that can be interpreted a lot of different ways. And so perhaps I'll narrow it down by asking, what do you think is going to be the most important focus of community resilience post-pandemic? There's a lot of things that we're doing from an emergency perspective now, but I'm curious, what do you think the big change is going to be from a community resilience perspective? Both, could be investment, could be partnership, communications. What area we focused on to prepare for, anticipate, and respond to the next major crisis? Curious what your perspective is.
Great, big question.
Yeah, I'll say, yeah, right. You tell us what it is. I hope that what we get is a willingness to work in new ways with people who haven't been at the table before. This is a social problem. The social distancing is such an unfortunate term when it's really physical distancing, and we need social solidarity. And to the degree we can, and when we act as if we're alone, we're going to fail. And so willingness to try new things and to hear new ideas, I hope that's one of the outcomes of this. That's not a full answer, but that's a piece of some answer.
Yeah, I think it's the intersectionality and their interdependence that is just so apparent on a day-to-day basis. And so I'm actually hoping that realization, this feeling of us all being in this together, right? It's not geographic and it's not demographic. That allows people to feel a sense of community and a sense of connectedness that also opens them to new kinds of solutions. And that sense of belonging actually builds a stronger sense of community and a stronger sense of solving problems together, because there's this greater recognition that problems really are, that we might have thought were other people's, are really ours as well.
So if I can say one word on that. So I don't know, any of you listened to the Ezra Klein podcast, where he interviewed a few weeks ago Eric Kleinenberg, who wrote the book about the Chicago isolation in the late 90s, where people died because they were alone in the heat wave. He also wrote a book called Palaces for the People about libraries, but he talks about this social connectedness that is the thing we have to push hard on, and that to the degree we're isolating, we're going to lose the battle. And I recommend that particular episode of that because I think it speaks to a lot of what needs to happen.
Yeah, and I would just add that there's been some really valuable research that Demos did along with Anat Shanker-Osario that looks at this issue of both race and class in this context of connectedness. And what it finds basically is that when people feel connected, when you talk about, for instance, race, and you talk about African Americans, Latinos, and white people to bind people together, that actually increases people's openness to these broader solutions. And I think actually this moment, again, provides this opportunity around creating that narrative. There's good information on the Demos website. And I would say also now there's really interesting work that's being done by PICO that's quite helpful in thinking about how to take that work and frame it in this current context.
Wonderful. Thank you so much.
It really is an opportunity for narrative change, as you described, Judith, when we have another 6 million people unemployed now, this is touching everyone.
Someone just texted in the chat box the Demos link. That is the correct link. It's the Race Class Narrative Project.
Fabulous.
And so you can find it on the Demos site. And thank you to Sarah for posting that. The other person who talks about this a lot is John Powell at the Haas Institute at UC Berkeley. And so you may also want to look at his work around othering and belonging. That really is also central to what we're talking about.
Great. Any last questions for Judith or Stu? This has been a really, really rich conversation. And I really want to thank you for taking time out of the days that I know are already way too long and way too stretched, Judith and Stu. So if there aren't any last questions, Melody, am I missing any? Looks like we're okay. We will now hear from Len Bartel and close it out with a poem. As in the past, we will email you with the materials, and this will be, we'll put the recording up on our website. Thanks again to Stu and Judith, and take it away, Len.
Thank you, Deborah. So this is a poem that I think folks probably have come across recently. It was originally tied to the Spanish flu, but it's a poem that I think speaks to the recovery and resilience that Judith touched on, the restructuring, and then this conversation at the end around resilience moving forward and new ideas. It was actually written last month in the time of this pandemic, and that's the title, In the Time of Pandemic. And the people stayed home, and they read books and listened and rested and exercised and made art and played games and learned new ways of being and were still. And they listened more deeply. Some meditated, some prayed, some danced, some met their shadows. And then people began to think differently, and the people healed. And in the absence of people living in ignorant, dangerous, mindless, and heartless ways, the earth began to heal. And when the danger passed and the people joined together again, they grieved their losses and made new choices and dreamed new images and created new ways to live and heal the earth fully as they had been healed. So thank you, Deborah. I don't know if you wanted to close this out again or.
Thank you, everybody.
Thank you.
Yep. Thanks, Len. Have a great week, everybody. We'll send you our next week's speakers shortly. Thanks so much.